Okay, everybody, welcome to Teaching About a Pandemic During a Pandemic. I'm Doris Ravotas, and I am joined by Rachel Roberts, who is in the background today. So if you have technology issues or questions about how to access the handouts, etc., put that in the chat and she will answer some of those questions. The handout is important for this workshop because it's basically we're going to share ideas in the three areas of the presentation. So if you have that in front of you, it'll help you to participate more fully. So let's look at a little bit of this. So just for a little bit about myself, I have a number of different roles. So I do teach at Western Michigan University, and I teach actually health literacy, and I teach other courses to people who are going to be health providers in the future. And then my other hat is that I work with the with the Kalamazoo Literacy Center, and I do a lot of work with English language learners and with literacy learners. I do some direct teaching and I work with tutors and help them to bring health content. And one of my big roles there is that I actually teach an English plus health program every summer, and I coordinate that program. Actually, I hire the teachers, but I coordinate that program. So I wanted to talk about this because even though primarily I'm going to talk about working with English language learners and literacy learners, I also work with college students. So if you are teaching people that are not necessarily literacy learners or English language learners, we'll talk about elements of that for everybody as well. Here are our session objectives. Basically, we're going to look at ways to deal with digital challenges in teaching. We're going to explore ways that scientific and civic literacy can be incorporated into educational elements, and particularly public health elements like pandemics. And we're going to talk a little bit about the challenges of misinformation and the solutions that might have to steer learners to reliable sources. So the plan today is to use that session handout. I'd like you to jot down your ideas. I've kind of sectioned this off so that in each of these three objective categories, I'll talk a little bit about some of the solutions that I have found, some of the approaches I have found, and then through the chat, we'll talk about what other people are doing. And so there'll be that show and tell and the back and forth. The other thing I want to do is that the conference folks will be able to pull together the chat elements that we haven't gotten to, and then I will post on the listserv a little bit about that and start a discussion on the listserv after the conference. So that may be a week or so after this. So part one is the virtual learning. So you might wonder, why do I have chairs here when I'm going to talk about virtual learning? Well, because I want us to remember our audience out there. When we're teaching virtually, it's easy to not consider the audience that you have and who you are actually teaching. And in my mind, you have to consider whenever you teach, but certainly with virtual teaching, who is your audience? It's audience, audience, audience. What's their digital literacy? What kind of digital access do they have? And what other kind of needs do they have so they can participate in what you are teaching? And so let's look at those elements here. As far as the digital literacy, you need to ask, don't just assume that people have digital literacy. Like all literacies, that people have holes in what they actually understand and know what to do. For instance, my college students, you would think that college students would know a bit about polling and how to use Zoom. But what I found is when we went to that kind of context, a lot of people didn't know how to do that, and I had to teach those kind of things. So even though they might have a lot of, we talk about how college students right now were raised in a digital age, they use things for certain purposes and not for others. Another really important thing is to try to teach to the most familiar format. So smartphones are the most commonly used digital technologies. We have found that the majority of people, even that are refugees and immigrants, have smartphones. So one of the mistakes we made to begin with is when we started getting people their technology, we gave them laptops. And then we started to realize that actually a tablet is much more like a smartphone than a laptop. And many people just use their smartphones as well when you're delivering content. When we're learning English, it's a little bit harder because it's smaller to do. So we'd like to encourage people to use tablets. And then the other thing is to really think about, you have to teach that literacy as you go. So you have to gradually expose people to new things. So an example we have is last summer when we went digital for the first time, and we had new immigrants with very little English, some of which who had never really had much schooling, didn't have much digital literacy. We just got them there. We got them to the Zoom class, and then we dealt with everything else at a later time. So, so then over time, we could kind of teach those digital skills gradually. This is how you see, how you make sure that you're seen. This is how you can mute yourself, etc. So digital skills are like other things. You need to do them gradually. So when you're teaching a kid how to read, this pre-reading that we do with kids when they're very little, of opening the book and showing them things, is a gradual process to the point of reading. Some of you might recognize this as Vygotsky's idea of scaffolding, that we kind of gradually expose people to new things. I think that's very important in digital skills as well. So what about access? Well, many of us had to get help get people access quickly in the pandemic last year. So partnering with others worked well for us. We partnered with the schools because schools were getting kids access, and then our adult learners could also use those laptops. Libraries sometimes would partner, governmental foundations. We got some grants to get that going. You can't forget the hotspots, because a lot of people might have a smartphone, for instance, but not reliable access. So helping to get that kind of access going. And then access, of course, means that they also have to know how to get there or get some help with getting there. So we use family members that knew how to get online. Sometimes we use phone directions, and you just called them and worked them through. But you have to be prepared with that. So we actually put together PowerPoints for the volunteers that were helping to get somebody through, so that you could say, this is what you should see on your screen right now. And then you could use those phone directions. Because we were working with English language learners, we needed to use some interpreters when there wasn't a family member or somebody that could help with that. And then if you're really advanced, and you might be able to get device access, kind of like your computer company can, your IT group that can get access to your computer, and then actually get people online that way. Because the digital access in the pandemic is, you can't sit next to somebody and show them how to do it. Doing it from a distance was the real challenge we found last year. Other kinds of needs in digital learning is helping people find the best place to participate in digital learning. So for instance, we had one couple that came on and they, there were 12 people living in their 2-bedroom apartment, and they had a hard time finding the best place, but they were able to finally find a corner near near the bathroom that was further away from both of the bedrooms and the living room, and trying to help people talk that through. Headphones were another savior for a lot of the immigrants, the refugees that live in very busy households, and learning how to use the headphones helped a great deal. Because of course, when you're learning English, you can't always mute because you need to be able to be talking. And then helping people understand that you need to see each other and moving their device around so that they could see them. And then things like supplies. So we started to, you're not going to have some of this, you may not have the same supplies. So we use, for instance, whiteboards to help with some folks. So here's some of my solutions for beginners in digital learning. These are ESL learners. We could use a whiteboard that you can put a word on, and when you're teaching English, you can just have one word. And I can maybe focus on that word and then hold up the vaccine sign. And so we got everybody those little whiteboards so we could write on them and share in that way. Because we're, using our regular books didn't work as well. And then the other thing that's happening when you're doing digital learning is that you've got other people there. So frequently we would have visitors. So people's children would be there, their dogs would be there. There'd be, other people that are curious what they're doing on their screen. So we just started to normalize that and use that. So here I am showing a picture of my daughter and granddaughter, and we can talk a little bit about that. And then you can talk about, what do they know about washing their hands? Maybe there's an 8-year-old there that will sit in on that movie about washing hands. Maybe that 8-year-old will show you a little bit about how they wash hands, for instance. Also for beginners, we use PowerPoints, and in our PowerPoints, we built in some of these learning elements. So we did matching words with some of the more difficult words. For intermediate folks, then we started using breakout rooms. That was a little bit too hard for our beginners in the beginning. Now, a year later, after they've been online for this long, we use breakout rooms regularly with the earliest learners, the people that have the least English. And then this is just an example from I know you can't read this, but I can use the most advanced kind of approaches with my college students. This is an online discussion because they, even if they've never used the discussion before, I can talk them through this because they have the access and they know how to use the digital elements before that. So now it's your turn. So I'm going to open the chat, and what are your solutions for your audience? So how does your approach consider digital literacy of your audience, the digital access, and the other needs of the audience? And so let's share a little bit. Somebody's mentioning don't ever assume again. Privacy issues, yes, that's a very difficult one. Like with telemedicine, we didn't have as much of that because we're teaching English, but that's a major one. A dialogue rather than a lecture. We'll talk later a little bit about, we used stories that helped us with some things in terms of open-ended discussion questions, great idea. Canvas tutorial, welcome modules, yes, to help orient people. Good, good. Reading level text, testing for text messages. Other ideas? Reaction buttons, yes. If you have people that are kind of at that intermediate level where they're understanding the basics of being on Zoom, as those reaction buttons can make a big difference. Oh, a pre-assessment on digital challenges, that's a great one, and what kind of worries or concerns you have. We did do that to a certain extent in our registration. We said, how comfortable are you with using Zoom, etc. But that's a great idea. And the lack of internet access. A menu of options, that's a good idea. Create an illustration, video clip, etc. Helping other people share their screens and learning how to do that or work on something together is another challenge, but something that could work. Okay, good. Great ideas. And then checking regularly for access changes. That's a important thing too. So, we all know that we get on Zoom and sometimes people disappear or there's something not quite right at that time. That really can throw people and they may not want to come back. Kind of normalizing that, I found, has made a difference. Okay, great ideas. I love to see these. Let's look then at the next element here. The next one is scientific and civic literacy. I think this is so important with the pandemic and teaching about the pandemic. People are thrown all sorts of words. And what does this mean? And what do you mean my vaccine is going to help somebody else? There's a lot of meat here. So when we're looking at scientific literacy, you're looking at what are the scientific terms that people are hearing and how much do they need to know about those, and how to interpret those, what kind of approaches are being used, what are the concepts, and actually, particularly in this pandemic, the changing nature of science. That's something we went back to continuously, because if you don't understand that science changes, it looks like people are just like, throwing up new ideas for fun, right? Rather than that we're, learning new things. If you remember an article many years ago that was put out by Zarkadoulis about scientific and civic literacy, that this really, I thought a lot about this as we went on. When you don't understand science to a certain extent, it's really hard to understand where do you go from there. So we looked at scientific terms. We introduced terms that people were using and tried to talk a little bit about some of those terms as we went along. Here we're talking about 3 different kinds of what is an immune system, what's the difference between that and immunity, and what about immunized. So particularly when you're learning English, these all kind of blend together, but I think for anybody, they can. So defining those scientific terms and going back to, remember what this means is an important element. Looking at scientific approaches. So we did a lesson on is our vaccine safe? And, how did we get here and what is this all about? Using actually the kind of the process from one stage to another was quite helpful for learners, because they kind of felt like, many of them felt like, okay, so somebody thought this might work and then we're trying it on people. But they're not understanding the research behind it, the lab testing, and then going through each of these individually and what goes into each step was important for people to understand that creation. And actually how much work went into this, how many people were actually in the clinical trials. So here's another one. Lots of picture-based infographics I use with scientific approaches. Here's a little bit about clinical trials, the stage at which we're testing the vaccine on people. So I've already talked about the bench laboratory work, the research, how people build on the research that happened before this, and the whole process of research, where we're looking at multiple studies and kind of standing on the shoulders of the people that came before us. Then looking at these clinical trials and starting to say, okay, so we started out with this very small phase 1, and then we're following these people before we give it to more people to look at what are the side effects and what problems there might be with that. And then moving into phase 2, and then again, you're having a larger group, and then you're ending up with the phase 3 that has thousands of people that are being tested on, and making the point always that this is long before it gets any kind of approval. So really looking at that step by step, and how safety is watched at each step in the process. The changing nature of science, I found, is one of the biggest challenges in teaching about COVID. In fact, the very first series that I did, I talked about how masks were not recommended, right? And I think that it was a week after that then masks were recommended. And I had to go back and say, okay, wait a minute, let's look at this. So over and over again, I would say, remember that this coronavirus is a new one. And we talked about the whole nature of this novel, the idea of the novel virus. And that because it's new, we're learning new things about it all the time. And so, and when people had questions, we would go back to that whole idea. And then what changed over time and why would it change? So we talked a little bit about the studies that the scientists had done and how masks help protect all of us. And then I used some of these infographics. This is from New Zealand. So here's a concept, looking at the scientific concepts. This is how the virus gets from person to person. When I'm teaching English, then we will look at some of the captions that are here, for instance. But using the pictures really helps people to think about, oh my goodness, it's in the air here. And then, what's the possibility? Why would you use masks? That you can go on to that. So this is from New Zealand. So it does say keep track of your movements, which is one of the things they were doing. But I think that we can also, be aware of the things that we have. So going, and I used a lot of the concepts that were much more visual and informatic kind of things. So then let's talk about civic literacy. So scientific literacy is really understanding what is science all about, understanding those terms, the process, etc. But then in something like this that is the public health, I think one of the biggest struggles is, well, what's my responsibility here? And what is civic literacy when we're looking at a pandemic? And what's became pretty obvious is that a lot of people don't have that civic sense of how we protect others. So returning back to that public nature of the pandemic frequently is important. So people might understand, for instance, oh yeah, I wash my hands because of the germs, but understanding that those germs we could pass to others as well is an important element here. Pointing out how stopping the spread is important to get back to normal, that, this is not a new concept at all, but really getting people to understand that stopping the spread just isn't just protecting you, that it's protecting others around you as well. And that the whole idea of we need the economy to get back and everything, it really depends on this. It depends on being able to stop that spread. And then then you can fit in the importance of protecting others, using a lot of illustrations just all the time. And then the other thing I would do is offer a challenge. What could you do here? After we talk about different stories, for instance. So let's look a little bit at some of this. So this is actually the same video that I used earlier, but then we used it later on to talk about what is getting a vaccine do here. So in this case, we're talking about, what if this woman got a vaccine? If she got a vaccine, it's protecting her from his germs. And then I'll let it play out so that people can see, oh, here she is walking through. And yes, if she's got that vaccine, then she can be fighting those germs that are here. So that's the protection of ourselves and getting the vaccine for that purpose. But then I can move to, what if this man got the vaccine? Then who is he protecting? He's protecting himself, but what else? And then I would have learners look at this. Okay, so if he had the vaccine, then how does this change all of this? And they start to get the idea that, his protection of others is important here. So this is just a plain old sneeze that is probably not filled with coronavirus. And then we talk about these illustrations. What do you see? I mean, always with illustrations, I do this. What do you see here and what's happening? So going back to the illustration I had of the different stages of the clinical trials, I could say, okay, these are the different stages. These are where people are involved in these trials. What do you see? What's the difference? And what order they're in? And we start to, talk in more details about what's going on here. Here's another, herd immunity, community immunity, using a lot of, again, the pictures and what's happening from being not immunized, and then what happens later on when no one is immunized, when some of the population is immunized compared to when most of the population is immunized. Particularly something after this, when you see that very clear example of, how things are spread and how that man could change things by him being immunized, how he's affecting other people, then you can go into this and they can have a better idea of what's going on from here. Now, of course, depending on how well your learners actually, how familiar they are with this kind of infographic, you probably have to go back and explain, what the different colors mean and how you're going from one thing to another. So another thing to do is to offer a challenge. So as we talk about this, this is where we're talking about stopping the spread and the importance of stopping the spread in affecting other people. Here's a challenge for the learners that I'm teaching. So think about going back to work or being around others, and then give them an idea. How are you going to practice that hand washing? How are you going to social distance? Where and when are you going to wear a face mask? What and when will you disinfect? And then you can start a discussion about why would you do all these things? What is the purpose of them? And what's, what are you hoping other people do and why? And so then you can get into this idea of protecting each other as a very important element in this pandemic. Okay, so your turn. Go back to your handout and give me some ideas on teaching scientific and civic literacy. Okay. So we have using plain language is really important in this element. Applying evidence-based strategies from behavioral change theorists. Good idea. Pushback from the community. Yeah, you have to be aware of what's happening in your community, what kind of, what's being supported and what's not. Yeah, that medical jargon is very important with this idea of, who's using that medical jargon and, what's happening in the medical field around pandemic and other issues as well. Clear graphics, really important. Using data, but you have to use data in a way that people understand what the data actually means. Glossaries, the plain language, just plain glossary that's online, that's put out by one of the insurance companies, United. Is a great glossary for understanding things and helping people look up elements of what you're talking about so that they have an idea of how to look it up and what resources to use. Building trust, yes, that's very important. Personalized information, yes, if you know that your audience has a particular, if you have a particular set of audience. So for instance, I teach English as a second language, but I teach to large groups. So it's mixed from different countries, for instance, different cultures. But if it was a particular culture, you could really personalize it to what they know from their own culture, right? And the pre-teaching vocabulary, yes, it's very important in terms of understanding some of the graphics. Okay, good. And you can continue to add things here. Like I said, I'll be able to talk some more about this on the listserv later on. Culturally appropriate visuals and language use, yes, very important. Again, going back to your audience, you need to know who your audience is for that. And then using participants as peer learning tools. We train some of uh, our our English language learners to work with people at the lower levels, and that works quite well. Good. So let's go on and talk about what I think is the hardest one, is challenging misinformation. So this has been the massive challenge for anybody with the teaching about the pandemic right now. There's lots of misinformation, and how do you actually get people to like reveal that they have some of that misinformation is one challenge, but also what do you do with it? So here's some ideas I have. So one is to pose a scenario. So sometimes people are not going to talk about things that they're really worried about because they're afraid that it's not going to be accepted. So posing a scenario with, and I'll show you one of these, which gives people an idea of what are the concerns that others might have, will also help with that. Asking learners what they have heard about a touchy subject. Sometimes they're, willing to say, yeah, well, I mean, I have heard that there is, this will change my DNA. And that's also kind of get them to kind of talk about what their concerns are. And more, what have you heard, then what do you believe about this, will help with that. And then don't scoff at people. Help them to answer them directly and work with them directly. So, for some of us, the idea of changing someone's DNA or putting a microchip in a shot is just kind of a ridiculous thing. That's not going to work. But this is a scientific, again, understanding, so if you don't understand how science works, that might sound fine. It might sound fine to go get a microchip in there, or, because we're talking RNA and people mix that up with DNA. So that might make sense to them, right? So, but you can't make fun of them. You have to be able to answer them directly and talk directly about what you know about the science. Frequently offer space for questions. So whenever I'm dealing with any of these health concerns, giving people space for questions that they might have about the topic that you're talking about. And then steer people to reliable information. So help them to find the information that is the most reliable. This isn't always so easy in this day and age, but these are important kind of ways to challenge misinformation that I have found helpful. So look, here's a scenario. So here's Juanita is a person that we have put in our training on COVID. Poor Juanita has had lots of struggles, including she's ended up with COVID and she's had anxiety about it, and she's had to do the testing. She's had to figure out how to go back to work, keep her family safe, etc. So here's just one slide about this scenario. To actually simplify this a little bit, I used it last Christmas when people wanted to travel. And Juanita and her family have always traveled to Detroit, which is the other side of the state for us. And they wanted to go there for Christmas and trying to make a decision on whether they should go there or not. So I simplified this down to the idea of whether to get the vaccine, because they were talking about maybe they could get the vaccine before Christmas, which of course didn't work anyhow. But here's Juanita, wants her mother to take that vaccine. And Juanita's mother, Maria, says, yeah, I don't think it's safe. They did it too quick. How can that be safe, right? So then Juanita decides to ask her friend Zainab, who's a public health nurse. And then Zainab can go in and talk about those vaccines. So you're not calling out anybody in that class or tutoring or whatever, however you're working with people about whether they think it's safe or not. But you've got this person, Maria, who is talking about the safety. And then you can talk about that issue. Asking learners directly about their concerns so here's one concern that somebody can bring up. Can the vaccine make it so women can't have babies? And then starting to talk a little bit about this. You can always say, have other people heard about this, that this is a concern of theirs? And you can work with that a little bit. And then you can, answer it within the PowerPoint, within, talk a little bit about what is known in this situation. And then I did put down here a resource that people could look up. And actually, you can work directly with people and look up those resources as well. Using those reliable sources. So in most of my classes, we go and look at different parts of the CDC site, the World Health Organization. I've found CDC to be a little bit more learner friendly. They've done much better over the years in plain language. Some things are still not quite as accessible as what we would want, but going to the CDC site has helped. And using materials that people are going to see is very often important. So in the beginning, most of you probably remember in the beginning, way back in the beginning of COVID, they had 2 posters that the CDC put out. One was on stopping the spread, and the second one is what to do if you get the virus. And using those posters to talk about, those elements are helpful because they're going to go to work and see them on the bathroom wall, for instance, or, something like that. So things that are natural in their environment is helpful, but helping them to recognize and, for our learners, sometimes it's going there and helping them to search for what they want. And for people that have more digital ability, that you might just kind of refer them to here and talk about how to search, for instance. Okay, so now this is your turn. How can we combat this misinformation of the coronavirus? So let me get back to my chat. Oh, that's a great idea. What about asking, what do you think the motivations are for people who started the rumor? Thought about here and providing sources. Pulling up that information while teaching is a great thing right there. Always showing where you obtain information. That's another great one. Being able to look at that. Oh, here's the plain language glossary. Thank you very much for that. Yeah, so that's a wonderful United Healthcare. A great resource is just plain clear. Here's another nice phrase. Here's what I know to be true. Oh, here's a good question, and I'm curious what other people think. Is the idea of, is that familiarity, risk of familiarity with misinformation if it's repeated? If you're repeating it in class, I assume what we're talking about. I think there is a little bit of risk of that, but I think it's important sometimes to, talk about it and get people to comment on it. Train the trainer approach. Define your terms. And don't get emotional. That's a really good one, because it's easy sometimes to look at, misinformation and think, oh my gosh, especially if you're fighting it day by day by day, and you think that the people are getting some ideas, and here it comes again. But I read about this, and here's the elements of it. Also, the other thing that I didn't mention is giving people some idea of the prevalence. So, for instance, when you're talking about the blood clot issue, the helping people see that this is a very small percentage of all of the people that got the vaccine, and maybe comparing that to other things like the blood clots if you actually get COVID, for instance, or comparing them to other elements that are risk assessment, being with that. Letting students assess the validity of websites, that's a great idea. Oh, and here's one straight from a vaccine clinic. Whenever you have a patient or family, mention that everybody that's working there has had the vaccine. Again, evaluating the source, yes, so important. Using community and leaders to carry the message. And of course, there's a lot now about using people from particular groups, and as your audience. Oh, here's a quote: QTIP, quit thinking of taking it personally. Focusing on the disease risk to the individual. Yes, that's really important, because when people are looking at the vaccine, they're so focused on what will this vaccine do to me, that they forget the other balance and what's coming on that other side. Oh, and influencers, the social media influencers, talking a little bit about them, and bringing that up and showing what people are. And the whole idea of, maintaining trust and making sure that you are not discounting what people are saying. So even if it doesn't make sense in your mind, some of these myths, you have to remember that it does. There's some logical connection for them, or some fear that it kind of goes into, that's already there for them. And here's a good article from Russ Bennett. So that's a great one for the misinformation has become a social determinant of health. I'm looking forward to reading that, Russ. Okay. All right. Any other thoughts here? So let me open it up for any thoughts on the teaching about the pandemic that we haven't talked about in these three categories, things that you have found particularly challenging, or things that you would like to, comment on here. Let's open it up for that. While we're doing that, I'm going to move to my next slides, because I wanted to make sure you have my email. So I'll go back to the chat. Are there common misconceptions found with various cultural groups? Well, now that's an interesting question. I guess I haven't found that particular cultural groups had particular misconceptions. I would say that some of the immigrants I work with who may not be documented have trouble sometimes with trust. And we know African Americans sometimes have trouble with trust for good reasons, for some of the history that we have, that we've had in our public health culture. But specific misconceptions about the vaccine itself, I don't know if anybody else has any particular things. Oh, the bleach, containing bleach being sold locally, yes. Alexis has put a link in here about understanding the misconception about the bleach and being able to. Now, one thing I would have to say is that bleach has, there is a history of bleach being a health solution. In some cultures, sometimes it has to do with skin color and trying to bleach your skin. And that might be more of an issue when they've heard people say maybe bleach will do this, that might make more sense to them. Somebody says misconceptions, where do I start? That's so true. And a few people are saying they haven't seen particular ones in groups. Oh, and the whole thing about why bother getting it if we're all going to need boosters. Yeah, I think, and to challenge that, you just have to go back to that basic kind of idea of community immunity, and the importance of, not passing it. It really is, to me, it's clearly a civic literacy, understanding civic responsibility. And some people, that's just foreign, and that it's important to kind of go back and talk a little bit about that. Yes. Oh, so here's a very good question. What if the audience is strongly focused on individualism rather than the greater good? I find that that is fairly common. And I think that this has really challenged that idea of that individualism. I mean, it is part of our American culture. We're really not a collectivistic culture. We're an individualistic culture. And I think we have a lot of work to do there to help for people to understand that. And I don't know about that. I wonder about long-term solutions being things like having more public health at even K through 12 level, where people kind of understand the importance of that. Maybe doing some looking at some of the other things so even the most individualistic folks do understand that you don't make highways by yourself, right? That school systems are set up, that there's some things that we do collectivism around. So maybe something like that. And the government overreach, yes, is another basic thing. I think really addressing that this is not a requirement is an important thing in terms of that a lot of people think the vaccines, when they came out, everybody's encouraging them, so that the government's just going to require that. And I think that that's trying to normalize that to other vaccines that we've taken can be really important. Yeah, so somebody mentioned that even healthcare workers often are not taking the vaccine. Using kind of those we've lost, those obituaries. Okay, good. All right, so I think that that's where I think I'll end. Thank you very much. So what I will do is that the IHA will send me the list of the comments, and then I'll take those comments. I will post on the listserv sometime next week and include some of those comments so that you can walk away with some of the ideas that other people have as well. So I appreciate everybody's sharing, and thank you very much for coming.